Welcome everyone to the April 29th Sacramento County Public Health Media Briefing. Just a reminder to keep on mute while our public health staff gives their update, and then we'll have a chance to ask questions when they're finished. So I will go ahead and give it over to Dr. Olivia Casirier.
Good morning, everyone, and thank you again for joining us. So I will just give a really brief update on our numbers. As of this morning, we are at 10,683 cases of COVID-19 reported to Sacramento County and 1,662 deaths. Our daily average case rate is at 8.1, so we are finally heading in the right direction. And for the first time in the last couple of days, our actually new cases has dropped below 100. So we are hopeful that this trend is going to continue, and we will continue to monitor in the coming days. And according to the blueprint, we are still in the red tier. And our case rate, according to the update this week, is 8.4 per 100,000. This week, the Centers for Disease Control did release new guidelines for people that are fully vaccinated in activities that they can engage in. And it includes new guidance that states that people who are fully vaccinated can engage in activities outdoors without masks. We are still waiting for our CDPH documents. They're still updating the masking mandate and several documents that are linked to the masking mandate. And once that is done, we will update our health order as well. And with that, I will turn it over to Rachel Allen to give us an update on vaccinations.
Hey, good morning. I've got our weekly allocation numbers for you, and then we'll just briefly touch on our strategy for Johnson & Johnson. So this week, Public Health and our partners received 22,000, or for next week, we will receive 22,430 doses of COVID vaccine. That's 10,530 doses of Pfizer and 11,900 doses of Moderna. And again, this week, we did not receive any Johnson & Johnson. The state did receive an allocation, and it did go to some counties, but Sacramento didn't receive any this week. And then I'm sure you're aware, earlier this week, CDPH and the Western State Scientific Review Committee supported the CDC and FDA decision to lift the pause on Johnson & Johnson. So Sacramento County Public Health is following that guidance, and we have reached out to our providers with a health alert, letting them know there's a new EUA fact sheet, both for patients and for providers, that discusses the small but increased risk of a blood clot with the J&J. And CDPH also released a document that we can share with patients. That's just a one-page document that covers risks and benefits and explains that the vaccine is safe and effective, the benefits outweigh the risks, but there is still a choice and that there are other vaccines available. So we're starting to work with providers and planning. Some of the community pop-ups had wanted to wait for J&J, and so we are going to go ahead and we're working with them to replan those. We are reinstituting the use of it with people experiencing homelessness and the homebound. But again, we're offering them a choice, and we want to make sure that we don't miss any opportunities to vaccinate. So if we only take Johnson & Johnson, there may be someone that doesn't feel that they want to take it. And so our goal is to have another vaccine available if possible. That brings along its own challenges to bring two different vaccines to a site, but we're working through that and hope to be able to get that going soon. And so we still have the 4,735 doses on hand that we had to pause. And so even though we didn't receive a Johnson & Johnson allocation this week, we do have doses available, and many of our partners have vaccine available as well.
Hi everyone, I'm Mike with Sacramento County Public Health. I'll provide a quick update around what we're doing to address vaccine hesitancy. Again, we are still working with our trusted messengers, community-based organizations, and leaders to help disseminate information to mitigate any misinformation or disinformation. In addition to that, we are working with our health system partners to see if we could work on some creative content to really ensure folks feel comfortable and safe with the vaccine. Some creative aspects or projects we're also working with our youth to really provide the resources and the information. And I think that's pretty much the update for how we're working to combat vaccine hesitancy.
Okay, thank you guys. So now we'll open it up to questions. We have quite a few people in here today. So if you can either utilize the raise your hand feature in Zoom or write in the chat that you have a question, and then I can call on you guys. Alex, go ahead. And if you could give your name and outlet, that would be great.
Hi, this is Alex Hendricks from the Sacramento Bee. I've got two questions. The first one.
Maybe not testing out this new thing.
The first question I have is that some counties in California and across the country have been seeing plummeting demand for vaccines, leading some places to even like shut down some of their mass vaccination sites. I'm wondering, has Sacramento County seen any kind of decrease in demand, like not necessarily giving out all the doses that it has capacity for? And then the second question I had is related to vaccine hesitancy. So this has been a trend in other counties in California, but men seem to be getting vaccinated at a lower rate than women in Sacramento County. And I'm wondering if there's any sort of targeted effort to encourage more men specifically to get vaccinated, given the health effects that are more likely to impact men than women.
I guess I'll answer your second part of the question. Specifically the targeted outreach, we are aware of certain factors and looking at through an intersectional lens, right? Including race, class, gender, and other various factors that really contribute to some of this. So I think this is where we really leverage in our community-based organization to do that specific and targeted messaging that is culturally appropriate, resonates with the audience that we're trying to reach to increase those numbers.
And Rachel, did you want to address the appointments, or
Sure.
Hannah?
Sure, I can start, and if Hannah wants to add, she can. Yeah, we are hearing reports. We're not operating a mass vac site anymore, but we are hearing reports and seeing that there is some decreased demand for appointments. And you know, and our strategy has been for us to move out into these community-based pop-ups more. We know that getting into the communities is going to be critical at this point. But at this time, the mass vac sites are going to continue to operate as they have been.
Just to jump in there, exactly what Rachel said is that we have been seeing a trend, and so we are pivoting again and utilizing our pop-up sites and working with our providers and CBOs to come up with and strategize of ways of being able to get into specific neighborhoods and areas. But as Rachel mentioned, the max vaccination sites are still open, and there's appointments available for day of.
Got Chelsea Shannon, ABC 10.
Yep, that's me. So with the lessening demand for vaccines, is there any concerns about waste of the vaccine at these clinics that are having a hard time filling appointments? And then also with the Johnson & Johnson pause, back when that happened, there were clinics that literally had to take their doses off, like away from the people needing the vaccine. Were any of those doses wasted?
I can address those. I don't think wastage is an issue. Again, we work with our providers every single week. We have a provider update call with them, and we have tirelessly reminded them that there can't be wastage, and not to pre-draw more than you can use. So there's just a very careful strategy you have to use at a mass vac site to make sure you're not overdrawing beyond the demand. And if you do that, you still have the rest of the doses refrigerated and they can be used the next day. I don't think doses were wasted for Johnson & Johnson. So the morning that the pause was put into place, I started receiving calls and texts at 5:30 in the morning from providers that were planning to go out that day, and they quickly pivoted. And, you know, that's a vaccine that's refrigerated and stable for transport. Even if you transported it to a site and we're getting set up, you could have moved it back to location. So that I'm aware of, there were no doses wasted because of the pause. And that provider that was using Johnson & Johnson that day quickly pivoted and took Pfizer instead.
Okay, Greg Fishman from KFBK.
Thank you. Appreciate the opportunity to ask a question. It seems like we're stuck in the red tier, and I'm wondering what's the strategy to kind of keep moving us forward. What do we have to do to start really being able to to improve that and open up more business? I mean, to kind of get past that red level. It sounds like the numbers are starting to head in the right direction, but what do we do now? What's the strategy?
The strategy we have right now, and I think we've mentioned this several times, is that the way out of this for us is vaccination. So as we've all mentioned in the team, that we are making a huge push to be able to have more pop-up sites in neighborhoods and make sure that we get to those that might have difficulty with getting to our larger vaccination sites. And this requires working very closely with community-based agencies that actually, some of them are going door to door, signing people up. We're also going to have walk-up availability where someone doesn't need to sign up ahead of time. They can just, when they know about a clinic, that they can just walk in and get vaccinated. And all of these are ways for us to be able to reduce barriers so that we can increase our vaccination rates.
Thank you.
From Sacramento Observer.
Good morning. Dr. Couturier just touched on part of my question, but I was going to ask about where the county stood with the original sort of idea of turning the neighborhood testing sites into vaccination sites, but it seems that you guys went with the pop-up model instead. Can I ask what factors went into that? Was that more effective?
We're actually using a combination. So some of the sites we have clinics on a weekly basis. And then for some of the sites, we just have 1 or 2 pop-ups and then move on to another site. It's all dependent on the need. And in doing this, we're working very closely with our partners in the community. For example, we're planning to have more clinics at churches. We're also looking at food banks because they've reached out to us and we know that people do go to those sites already. So looking at different places where we can have people, where people usually go so that we can make the vaccine available. We've also been able to use some of the sites that we were using as testing sites and had pop-up clinics there. So it is a combination.
Can I ask what are some of the sites that were testing that became pop-ups?
Yes. So we're working with our health systems to support some of these community sites. That some of the sites include the Robertson and Del Paso Heights, La Familia here in South Sacramento. In addition, we have the Folsom, the Rancho Cordova Community Collaborative, and the list continues. Asian Resource Inc., et cetera, et cetera. Those are a few examples.
Thank you.
Michael from Sacramento Bee.
Hi, yeah, I was just wondering, you mentioned that the Johnson & Johnson vaccine, there were no allocations for Sac County this week, but there were, or for next week, but there were for other counties in California. I'm wondering if you have any insight onto why that is, or what determines which counties do and don't get Johnson & Johnson when it's so limited, and if the current inventory, like you, I think you mentioned there were 4,300 or so doses before the pause. Do you know if that goes into those decisions or what happens there? Thanks.
I don't think we have a great insight into that without, and that's a great question, I think, to take to the state. They have a formula. They're working with Blue Shield to determine the number of doses that go to counties and which formulation of the COVID vaccine to send. I think with the doses that we have on hand and with what our providers had on hand is sufficient to get us through next week, and then hoping that allocation for Johnson & Johnson will come back for us.
Brandy from Natomas Buzz.
Hi, thank you. I have two questions and I'll go ahead and ask them, and whoever's best to answer, appreciate it. First, yesterday's case count number was 50% lower than the day before, and that seems like a dramatic drop. Wondering if that is a data error. And second, I know that the vaccination clinic at the Mexican consulate was only able to service 347 people out of the 500 spots they had available, and that was even taking walk-ins. And that today the Natomas High School Clinic is taking walk-ins because they did not fill all their appointments. So do we feel like these are still effective vaccination sites being drive-through, or have we reached a saturation point? And I understand the comments regarding working collaboratively with community organizations, but what is being done maybe to address the access issue in terms of transportation to some of these sites? If people don't have cars and regional transit doesn't service those neighborhoods, how are individuals expected to participate in these clinics? Thank you.
Sure, I'll start off and then I'll let the rest of the team answer as well. As far as the numbers, yes, we did notice a dramatic drop in the daily case numbers. And so of course, we're continuing to monitor. We've checked with our epidemiologists and they have not detected any errors or delays, but definitely we will continue to monitor that. As I mentioned at the beginning, in the last couple of days, our numbers have dropped below 100. So that is a good sign, but definitely we need to continue monitoring and seeing whether this is an ongoing trend or if there's something that has happened that has resulted in that. As far as vaccination sites, I think it's the being able to provide different options is important. And so there is still a value in having the large sites. And one of the things that we did right at the beginning was just make sure that we were looking ahead at being able to provide additional ways that people can get vaccinated so that we're not dependent on just one site, one or two sites, or one way of delivering the vaccine. So there are many options, and that I think that is a good thing. I think what's important is for us to continue putting the message out about the importance of vaccination and us being able to get to the, getting enough people in the community vaccinated that will drive down these numbers and also help us to get to the point where we can open up even more. And I'll turn it over.
In regards, I'll take your second part. And in regards to the as Dr. K mentioned, I think this is why it's critical that we utilize a multi-pronged approach. We understand that transportation barriers are in existence, so we work closely with Sacramento Regional Transit, SAC-RT, onto whatever community clinics that we host, seeing if there's a possibility of expanding some of the efforts so community members could get free rides. They also provide other for individuals with disabilities. There's a resource there that they will take folks to get vaccinated. So we are in partnership, and I think this is why we really leverage utilizing multiple alternatives, such as the community meeting folks where they're at and providing to eliminate and mitigate as many barriers as possible.
I have a follow-up question from Chelsea Shannon.
Hi, so vaccine hesitancy, we've talked about it. Our station talks about it a lot. Is it as big of a problem as we like to talk about it?
I think that's hard to say because we are still seeing a lot of demand. We know it's out there, and we are, especially on social media platforms, we do see what people are saying. And so we know that we do have to address it. And so and part of what the way for us to do that is, again, working with trusted messengers and also being able to provide a forum where people can ask questions. And that's the reason why we actually set up the forum that we have twice a month, where people are able to ask questions. And we've had a lot of people asking questions about the vaccine. And we do have a professor from UC Davis available also to respond to some of the more scientific questions that people have that are specific to how the vaccine works, how the studies were done, and to speak more about the safety as well. So we you know, it's hard to measure at this point. We know it's there, and we know that there are some studies that are, or surveys that are being done, and that might give us an idea of what to expect. But right now, what's important for us is to make sure that we keep going out there, getting people vaccinated. And as long as we have people who are willing to get vaccinated, I think we have work to do.
Okay, it looks like there's a question in the chat from Greg. Do we have numbers on how many people are being vaccinated in Sac County per day and per week?
I'll have to take that back. And part of the reason it's hard for us to answer that right away is that, one, there's a delay in reporting because it has to go into the state database, and then we get reports on that. And also because it's not only public health that is providing the vaccine, we also have our health systems, we have pharmacies. So there are a lot of different places where people are getting vaccinated. So it takes a while to get that information, but we'll take that back and see what we can provide for you.
And Greg, I also just provided a link. If you haven't looked at our dashboard, then please do. We do have some data on there about our vaccinations in Sacramento County.
Okay, thank you.
Follow-up questions. So no concerns about vaccination saturation at existing clinics.
Thank you.
And then I have a follow-up question from Chelsea Shannon.
Would it be possible for us to get updated numbers on the breakthrough cases as we've gotten before? And then also, does the county have any information about who is dying? Is it mostly workers, as UC Merced found?
I'm sorry. So I got your question about breakthrough cases, and epidemiologist is not on today, but I will take that back to her. And could you repeat the second question?
So a study from the UC Merced that the SACB put out showed that a higher percentage of workers are dying in the Central Valley. I was wondering if similar numbers are up here in Sacramento County.
I'm not very familiar with that, so I'm not sure what exactly it pertained to. We do have information on our dashboard on the deaths. So are you asking by occupation or?
Yes. Occupation.
Yeah, I'll have to see if we have that. Usually we might not always have that available, but I'll see what we can get.
Then I have a follow-up question from Brandy at Natomas Buzz. Are we not at all concerned about saturation at some of our existing clinics?
There is some concern because appointments are not all getting filled up as they were a few weeks ago. But what I did say is that there's still a value in having those sites because we're still having a lot of people signing up. So we will continue to monitor.
Okay, then I have a question from Lonnie, Fox 40.
Yes, just following up on Greg's earlier question about the being in the red tier. It seems like Sacramento County is still behind other counties in terms of infection rates. Is it just too tough to determine what the cause of that is? And you're sort of going down the path of just more vaccinations? And why is it difficult to identify why Sacramento County and some of the other counties are not doing as well as big urban counties like San Francisco and LA?
Part of it is because we don't have any large outbreaks. So we know that it is due to community spread. We are, in looking at the numbers, we anticipate that it could be due to several factors. One of them could be because the way that the tier system is set up, it is dependent on testing volume. So that could be a part of the issue. The other also is we are aware that there are variants that are circulating. We don't know just how big of a problem that is because we don't do the genetic sequencing on every single specimen. But from the sampling that we have, the results that we have received, we know that we do have variants, and we know that some of them are tend to be more infectious, more transmissible. So that could be a factor. The other also is, I think we are lagging behind a bit with vaccinations. And so we are continuing to work on that to make sure that we are able to, make up for the disparities that are quite evident. And that's why we are working so hard with the pop-up clinics to make it easier for people to get vaccinated. So I don't think it's one factor. I think it's multiple factors, but it's hard at this point to pinpoint exactly, what the issues could be. But these are some of the things that we think are contributing to that.
I have a message from Genoa about nationally, it is being reported that people are skipping their second dose. Are we seeing that locally?
We are analyzing that right now, and unfortunately, again, because our epidemiologist is not here to let you know more about it, I think that's something we can follow up on. In general, at least from the first analysis that was done, it does look like the majority of people are getting their first and second doses, but we'll analyze it further and provide additional information.
Lonnie, did you have a follow-up question? With your hand up still.
No, I'm fine, thanks.
Okay. So I don't see any other hands up or any other questions in the chat. As a reminder, I will send out this recording in its entirety later this morning, and as well as some of the follow-up data that was requested when we get it. And we will see you guys next week. Thank you for coming.